While staying with our COVID-19 coverage, the National Institute for Communicable Diseases says another 75 people have died from COVID-19 in the latest reporting cycle. This as the Omicron variant continues to spread across the country. While the NICD says that a total of 90,662 people have died from the COVID-19 pandemic to date. The NICD says the test positivity rate continues to hover at around 30%. This is 6 times the rate at which the spread of the virus is considered to be under control. People are urged to get the vaccine as it is safe and effective in preventing severe illness from the COVID-19. Now, the Johnson & Johnson booster jab is also available from today for eligible people. On that note, as we heard earlier, the quarantine and contact tracing is to be stopped. The Health Department says the decision to close COVID-19 quarantine centres is because they don't have an impact anymore. But on that note, let's to join us for this discussion, we're joined via Zoom by Progressive Health Forum convener Dr Aslam Dasoo. Dr Dasoo, a very good afternoon. Thanks for joining us here today.
Good afternoon. Thank you for inviting me.
Let's get into the conversation. I mean, Mr. Dasoo, is this the right decision considering that not much is known about Omicron at this stage and some provinces are still peaking as we speak?
Yes, very much so. It makes perfect sense given the state of the pandemic and what we have learned over the last 2 years. Look, our rate of testing is demand driven. It doesn't pick up all of the cases in society or in the broader population. And so if you test just those that you are testing and perhaps do, follow up for their contacts, you're missing thousands and thousands of people. And, by a multiple of 7 in terms of those cases reported positive and what may be out there. So in all, this is a very logical step. It also frees up resources to do the more important and needful things, such as pushing for higher rates of vaccination.
On the same breath, the department also announced yesterday that from today, J&J booster vaccinations will be available to those who received the initial Johnson & Johnson vaccines less than 2 months ago. I mean, what's your reaction to this?
No, that's also very welcome news. And I'm really pleased about the swiftness with which the department has taken SAPRA's ruling and has opened up vaccination for the second dose. We do know that the Johnson & Johnson vaccine has quite extended durability, particularly in terms of the T-cell immunity, the level of immunity that prevents you from progressing to severe disease. However, it's accepted now that a second dose of the J&J is appropriate, as we have with the other vaccines, both mRNA and adenovirus vaccines. So opening this up right now will not only increase our rate of vaccination, but also provide protection, especially during this particular surge.
Whilst we're getting updates on what's obviously happening with the latest regarding COVID-19, we obviously saw yesterday that the Competition Commission and South Africa's 3 largest private pathology groups, have agreed to reduce the price of the COVID-19 rapid antigen tests to no more than 150 Rand. I wonder if you could give us your take about the impact this is going to have in the country's fight against COVID-19 going forward.
I think it's very useful. Clearly, high prices are a barrier to testing, and this arrangement that they have come to with the Competition Commission is very useful. But look, the public sector provides testing for free in any event, and these private labs really cater to the insured population and perhaps mostly the middle classes, those people with means and able to pay out of pocket. But even for those people, the higher prices was quite prohibitive, and I think it was a disincentive to test. Now you'll find more people being amenable to testing, better for us to be able to provide surveillance on that score. Look, I mean, I think these set of measures, both, from the testing to the quarantine to the revised protocols on isolation, are all as a result of of the experience gained over these last 2 years on how we've tried to manage this, and we've seen what works, what doesn't work, what maybe need to be tightened, what can be dropped entirely. And I think we are at a point right now where we have a handle on how this pandemic spreads and how best to contain it, utilizing the resources we have. Now, we've had 2 very tough years, and I'm sure people are very tired, and especially at this time of the year, there is a strong desire just to be more relaxed. And I think what we need to do is to keep things simple. You have a raging surge at this moment. You don't want to get infected. So do the proper things there. And they're masking, avoid all large gatherings whenever you can. Stay outdoors as much as possible if you're with people that you don't normally live with, or so on. And it's at that very basic level that you will make a difference. Then, of course, get vaccinated if you haven't been, get your boosters if you're eligible for them. And it doesn't really matter whether you've taken the Pfizer shot or the J&J shot. The best, as the adage goes, the best vaccine is the one in your arm. And I think this is something that we should embrace as we go into 2022. If this variant, if it portends a declining severity of the pandemic, this is very good news, but we don't know. And, a studied reserve is necessary. Remain concerned, remain on your guard, because even if you do get a mild infection, that doesn't really prevent you perhaps from getting long COVID, which is a very miserable condition. So there's lots of reasons to avoid getting infected and protecting yourself.
Dr. Dasoo, let's conclude this conversation just on the back of what you've been echoing. I mean, what are your further concerns heading into this festive season regarding COVID-19?
Well, look, I think obviously there's going to be a lot of movement of people as they go on holiday, return home. And that movement is always a risk. As people, particularly on public transport, you can't really distance and so on. So just be sensible as far as that is concerned. There's also the inclination for gatherings at this time. Now, we know this is the second holiday period that we're really constrained by this pandemic, and people may be feeling very frustrated. And I would urge them just to take a step back and understand what we have come through here. The global death toll is well over 5 million, and you can multiply that by 3, and the total number infected is some 280 million, and you can multiply that by 7 to understand the impact of this thing. So let's take it seriously. Let's show the virus some respect, by protecting ourselves from it, because you can't really fight it. It's not a war that we're engaged in. This is a natural and an evolutionary agent that's going to do what it does. We are its hosts, and we need to prevent ourselves from being amenable to hosting it. And the best way to do that is to avoid getting infected and be vaccinated. And maybe in 2022, things will begin to change. But right now, consider ourselves to be in the grip of this pandemic.
Revised COVID-19 quarantine and contact tracing protocols in place. Again, as we heard earlier on, quarantine and contact tracing is to be stopped. Dr. Aslam Dasoo.